to our dear Prime Minister, Honorable Shri Atal Behari Vajpayee, to give us the inaugural address.
भगवान श्री सत्यसाई बाबा, गवर्नर ऑफ कर्नाटक श्रीमती रमा देवी, चीफ मिनिस्टर ऑफ कर्नाटक श्री S.M. कृष्णा, चीफ मिनिस्टर ऑफ महाराष्ट्र श्री विलासराव देशमुख, sisters and brothers, before I begin, I would like to apologize for the long delay in my arrival here. I had to attend 2 other functions this morning. They went on longer than expected. I would like to thank you all for waiting so long and so patiently. I know you have been waiting for Baba, not for me. I am honored by Bhagwan Satyasai Baba's decision to invite me to inaugurate this magnificent temple of healing that he has built in the capital of Karnataka. I have visited this temple, his temple of learning at Prasanta Nilayam several times. I have also seen his super speciality hospital at Puttaparthi. I had then remarked to myself that the people of Andhra Pradesh were lucky to have such a magnificent hospital. I am glad that neighboring Karnataka too can now share in the spiritual and physical well-being that Bhagwan generates. Friends, I have seen many hospitals in India and abroad. In some of them, I have also been a patient. As was the case most recently at Breach Candy Hospital in Mumbai. However, I can honestly say that I have rarely seen a hospital so magnificent, so grand, and so breathtaking beautiful as this one. When I first saw the photographs of this institution, I told myself that this cannot be a hospital. Rather, it looked like a palace, but a palace with a difference, a palace of healing that is equally accessible to the poor as it is to the rich. I use the word palace deliberately, for Baba is truly an empire of the soul, an empire that knows no national boundaries and no divisions of caste, creed or color. From what I know of the meticulous care with which Bhagwan runs every institution of his, and he runs an incredibly large number of them, I am confident that the insides of this hospital will more than match its outsides. As always, he has assembled a team of the best doctors and staff. Again, as always, many of them are voluntarily offering their services to Baba and to the people. The high domed prayer and meditation hall in the center of the building alone makes this place a unique combination of temple and hospital. It will surely generate tranquility and hope in patients' minds. Sanctified by divinity, it will encourage the curing of diseases, not merely of the body, but of the mind and the spirit as well. Friends, to me, what makes this hospital unique is the largely free services by which the poor too may get the same 5-star health care as the rich do. There are many private hospitals in our country, in big cities, whose doors are closed even to the middle class. The rich too will be a good deal poorer in the wallet when they take treatment from these hospitals. By setting up this hospital, Baba has shown that just as the doors of a temple do not recognize the feet of a rich or a poor, so too should a good hospital offer its services to all those who need them. Baba's ideal, which is also my ideal, is best expressed in a Sanskrit shloka, na tvam kamaye rajyam, na swargam, na cha punarbhavam, kamaye dukha taptanam, pranenam artanashanam. It means I long for neither state power nor for heaven or reincarnation. My only desire is to see that the sufferings of all living beings are removed. Friends, the present healthcare system in our country is a far cry from this ideal. India still has only about 5 hospital beds per 1,000 population. We also have only 6 or 7 physicians per 1,000 population. As a result, a majority of our population is still serviced by practitioners of traditional medicine or by those who are not adequately trained. Nearly 7 lakh children die every year due to diarrhea, which is easily preventable. More than half of pregnant and lactating women are anemic. No wonder, for the poor, health care accounts for among the largest chunks of their meager family budget. It is now obvious that government's resources alone cannot suffice to meet the health care needs of our growing population. We have to think and act in alternative and innovative ways to achieve our objective of health for all. We need to radically revamp the government-run healthcare system to make it more effective and efficient. We need to create greater linkages between public and private healthcare systems. The government would like to encourage more private sector investment in secondary and tertiary healthcare. At the same time, I would like to see private practitioners and private hospitals carry a significant share of the burden of public health care. But whether a hospital is in the private sector or in the government sector, it can promote the public good only if the people working in them are guided by the overriding principle of seva. And this is where we can all learn from the institution of Baba. He attracts the most qualified and competent professionals to work in his colleges and hospitals. But what impresses us is not only their qualifications and expertise, it is also the humble, self-effacing and devoted service that they render to one and all. We need this combination of professional excellence and service orientation in all walks of our national life, in healthcare as well as education, in industry as well as administration. The task of providing quality health care to 1 billion people is by no means an easy one. It cannot be met by over-dependence on the curative approach, which is neither affordable nor accessible to many of our citizens. Even rich nations are finding it difficult to sustain their expensive healthcare systems. It is therefore necessary for India to promote preventive and community-based health care. As is well known, prevention is always better than cure. Unfortunately, preventive medicine in our country has so far been largely neglected. In the case of some diseases like HIV/AIDS, prevention through awareness is the only medicine. We also need sustained campaigns aimed at educating the people about the best basics of health living, a good diet and exercise. To start with, we should promote cleanliness in public places in a big way. One of the many things that impresses me about Baba's institutions is how spotlessly clean every nook and corner is, although thousands of people visit them every day. Here too we can learn from Baba and his devotees. To make effective and affordable health care widely available, we also need to give greater encouragement to Ayurveda, yoga, other Indian systems of medicine and homeopathy. Unfortunately, these indigenous systems have not yet found their rightful place in our overall health care strategy. Our government has been doing much to correct this imbalance. I agree, however, that we need to do much more. Before concluding, I join all of you in wishing this institute the very best. May all the future plans come through and may it quickly become a sacred symbol of Baba's generosity to the people of this country. मैं दो शब्द हिंदी में भी कहना चाहूँगा। हम दवा के लिए अस्पताल में जाते हैं, लेकिन जब मर्ज बहुत बिगड़ जाता है, डॉक्टर हथियार डाल देते हैं, आशा निराशा में बदल जाती है, तब फिर दवा काम नहीं आती, दुआ काम आती है। ये ऐसा अस्पताल है, अनूठा अस्पताल है, जहाँ दवा भी है और दुआ भी है, जहाँ वेणुगोपाल जैसे डॉक्टर भी हैं और बाबा जैसे संत महात्मा भगवान भी हैं, जो आशीर्वाद से लोगों के जख्मों पर मरहम रख सकते हैं। बहुत बहुत धन्यवाद।